Blocking the tear drainage duct of the eyelids with punctal plugs has been around since the 1970s. But the question is this something that's still a viable option for dry eye disease today? Let's focus in. Hey, howdy everybody, this is Dr. Neil Gaiman, Dr. Eye Guy, with the channel that keeps your eyes healthy and your vision clear. With this video being part of a series of videos all about dry eyes. So definitely check out the link to the video playlist in the description below. Now, punctal plugs has been around for years. It's been a tool in the toolbox of dry eye treatments. And so let's go over exactly what they are and what they do. Now, we all have holes in our eyelids called puncta with a little canal that drains all the tears out. Now, this is actually a good thing. When we blink, our eyelids actually force tears out. It cleans debris out of these canals and into the nose. Now, the idea with dry eyes, if you're able to control or block the drain with a punctal plug, you block a punctum, then the idea is that it'll keep the tears onto the surface of the eyes longer. Now, usually when you're talking about punctal plugs, usually a doctor will plug the bottom punctum. That's because about 80% of the tears drain out the bottom, 20% out of the top. But in more severe dry eye cases, they may plug both puncta. Now, there are mainly two different types of punctal plugs. Temporary punctal plugs, usually made out of collagen, can last weeks to months and will dissolve when it's all said and done. Now, this video is actually a video of my right eye getting a punctal plug placed in there. Now, usually when a doctor does this, they may use a topical numbing drop anesthetic just to make it more comfortable. Not necessary though. It's not painful to get the punctal plug in there. They also might use a dilator tool to open up the punctum a little bit wider to make it easier. And then they'll use forceps or an insertion tool to put the punctal plug in its place. The second type of plug is considered a permanent punctal plug and can last years. Usually made out of silicone and usually has a little cap on there to sit flush with the punctum. Now, one thing about punctal plugs is sometimes they can be irritating to the patient. 99% of the time, the patient won't feel the punctal plugs inside the eyelids. But sometimes, especially with the permanent punctal plugs, they can be sitting up a little bit and actually rub on the surface of the eyeball and cause irritation or a foreign body sensation. But usually in that case, that silicone permanent plug can be removed or can be pushed down a little bit to sit flush with the punctum. There's also a slight chance of an infection or an allergic response if you're allergic to the material of the punctal plug. But usually this can be cleared up with either antibiotic treatment or removing the punctal plugs if needed. Now, just really quick, if you have any questions about punctal plugs or have had any experience with punctal plugs, definitely share it in the comments below. I'm sure a lot of people would love to hear it. Also, hit that like while you're down there. Now, here's one of the biggest contraindications to punctal plugs. Like I said, the idea with punctal plugs is to block the tears from draining out of the eye. You want to keep the tears on the eyes longer because that person has dry eyes. Now, sometimes the tears have poor quality, poor consistency, might have inflammation, inflammatory markers within the tears. And so sometimes you don't want to block those tears. You want those tears to drain out. If you block the tears and keep the tears on the surface of the eyes, it actually might make the condition worse, might make the symptoms worse. Now the big question, where do punctal plugs fall in place in the fastly evolving options of dry eye treatments? Now this is something that you will want to work with your eye doctor very closely. You want to know specifically what type of dry eye disease that you have. Now with me personally, I have become more selective and more specific on what patients I recommend punctal plugs to. Nowadays, with every year, it seems like there's more and more dry eye treatments that target specific dry eye diseases like meibomian gland dysfunction, evaporative dry eye disease, aqueous deficient dry eye disease, certain medications and treatments targeting specific layers of the tear film, lipid, oil layer, aqueous water layer, mucus layer. Certain medications and treatments can target more specifically. Now, punctal plugs is still a big tool in the toolbox of dry eye disease that I still use, but you might find some people that when they get punctal plugs, it will be the answer to their dry eyes or significantly reduce their dry eye symptoms. But you'll also find people that don't notice any difference with punctal plugs or might make the condition worse. Now, one of the biggest takeaways is to make sure that you check with your doctor to see if punctal plugs is a good option for you. Now, if you're curious about dry eyes, dry eye symptoms, dry eye treatments, definitely check out my playlist right there. Make sure you're subscribed. I have a lot more future videos coming out about dry eyes. I'm Dr. Neil Gaiman, Dr. Eye Guy. Stay focused.